The overall goal of this stereotactic body radiosurgery procedure is to deliver radiation that sterilizes gynecologic cancer targets. First, women lie on the flat tabletop and have cross-plane radiographic imaging equipment and the target localizing system track soft tissue fiducials. The second step is to confirm that the fiducials are in the expected cancer target location. Next, if automatic registration indicates soft tissue fiducials have shifted beyond predefined 6-degree tolerances, treatment is automatically paused. Patient repositioning then occurs. Once all of the tracking systems confirm patient positioning, stereotactic body radiosurgery radiation is delivered to the cancer target. Ultimately, stereotactic body radiosurgery is used to ablate cancer targets with sub-millimeter precision.
Cyberknife radiosurgery involves the use of a linear accelerator mounted on an industrial robotic arm, similar to those machines used to make automobiles. The robotic arm moves the linear accelerator in three-dimensional space around a patient as it progresses through multiple beam stops for beam delivery.
Cross-plane x-rays are obtained during treatment to verify the patient is in a correct treatment position. Since treatment beam delivery is not restricted to a two-dimensional plane, the system further enhances the ability to deliver concentrated radiation doses to cancer targets while minimizing the radiation dose to critical skin and visceral organ structures.
Treating physicians and patients must appreciate that stereotactic